Hello, friends. Nerd Pediatrician here. Today we're going to talk about why you don't need antibiotics for the common cold. Disclaimer first, this information is being presented for educational purposes only. It is not intended to diagnose or treat you or your sick child. Let's start off with some hot facts on the common cold. First and foremost, the common cold is caused by a virus. In fact, many different types of viruses. The biggest culprit is rhinovirus, and there are over 100 subtypes of this, causing about 30 to 50% of all common colds. And then rounding out the difference, we have things like adenoviruses, enteroviruses, and let's not forget influenza, RSV, and COVID-19. The common cold is in fact common. Most children under the age of about 6 years will have about 6 to 8 of these per year. Symptoms are what you would expect: nasal congestion, sneezing, sore throat, cough, fever, just not feeling great. Okay, so the common cold is caused by a virus. What's important to know is that antibiotics are effective only against bacterial infections. So whenever I consider prescribing a medication for a patient, I need to think about the risks and the benefits. Knowing that the common cold is caused by a virus, I know that there's no benefit to prescribing an antibiotic. So essentially, that makes that equation very one-sided. Common side effects associated with any sort of antibiotics are gastrointestinal issues like nausea, vomiting, abdominal pain, and diarrhea. Also, it can increase the risk for yeast infection, and some people will develop a rash after taking an antibiotic. Less common adverse effects that are more serious include a serious allergic reaction, what we call anaphylaxis. It also increased the risk for developing something called C. diff colitis, which is a very extreme diarrhea, which can eventually cause organ damage and even death. Finally, we think about things like end organ toxicity, so damage to the kidney or the liver, depending on what sort of antibiotic we're talking about. Now, on a population level, indiscriminate use of antibiotics can lead to an increase in antibiotic-resistant bacteria. In fact, the CDC estimates that there are 4.8 million infections in the United States every year caused by drug-resistant bacteria, resulting in about 35,000 deaths. We know that the common cold is caused by a virus, but how do we as doctors know that your child is in fact presenting with the common cold? Well, we ask questions, we examine your child, we look for evidence that there's something else going on. One of the more important questions to ask is the timing of the symptoms. Most upper respiratory bacterial infections like acute sinusitis develop after a viral upper respiratory infection or the common cold. Estimates put this at about 6 to 9%, so not a huge amount. So what we look for is how long the symptoms have been there, how severe they are. And in particular, we look for what's called double sickening. So your child seems to be feeling better, the fevers have improved, the symptoms are improving, and then all of a sudden they start backsliding. So that can be an important clue to a bacterial infection. Antibiotics are the most common class of medications prescribed to the pediatric population. In fact, 1 in 5 visits to the outpatient clinic results in the prescription of an antibiotic, and more than half of these are unnecessary. Those in the medical field are charged with prescribing these appropriately and being thoughtful about it. This is called antibiotic stewardship, and it's designed to protect the efficacy of these medications moving forward. During his Nobel Prize acceptance speech in 1965, my man Alexander Fleming predicted this problem. Then there is the danger that the ignorant man may easily underdose himself and, by exposing his microbes to non-lethal quantities of the drug, make them resistant. Thanks, Alex. Antibiotics are helpful when prescribed appropriately and, in fact, have saved countless lives throughout history. However, indiscriminate use can lead to not only harm of the individual patient, but also public harm. Thank you so much for watching. I hope this information was informative to you. If you have questions, please drop them in the comment below. And thanks again for watching. Nerd Pediatrician out.